5.5 Medical Applications Using Radioactivity. Different radioisotopes are used to diagnose and treat a number of diseases. The learning goal here is to describe the use of radioisotopes in medicine. Now, radioisotopes with short half-lives are used in nuclear medicine because the cells in the body do not differentiate between non-radioactive atoms and radioactive atoms. And once incorporated into the cells, the radioactive atoms are detected because they emit radiation giving an image of an organ. So if you look here at table 5.8, medical applications of our radioisotopes, you will notice all these different radioisotopes that are used for something like pancreatic cancer, whether it's your PET scan, whether it's treatment of bone cancer, abdominal imaging, liver cancer, pulmonary function diagnosis. Anyway, we're going to look at some of these. So which of the following radioisotopes are most likely to be used in nuclear medicine? Potassium-40, which has a half-life that's really long, or potassium-42, which has a half-life of 12 hours? Well, A, it's not going to be this one that's really long, because we already discussed about that in the last section. It's going to be something that's going to have a half-life that's a short time. Or iodine-131, half-life of 8 days, that would work too. So both B and C would be used because their half-life is short enough that eventually the person would be safe to then get around, if you're a young baby or something. So, we just talked about that. Now, after the patient receives a radioisotope, the scanner moves slowly across the body above the region where the organ containing the radioisotope is located. The radiation technologist determines the level and location of radioactivity emitted by the radioisotope. The gamma rays emitted from the radioisotope can be used to expose a photographic plate, producing a scan of the organ. So if we look here, here's a thyroid scan that shows the accumulation of radioactive iodine-131 in the thyroid. So here's them doing the imaging here on our throat, and here is this scan, and it is showing the accumulation of the iodine-131. Now in a PET scan, which now let's look at the name of what a PET scan is, positron emission tomography. Oh, positron, you know what that is. We just talked about it a couple of sections ago. So in a PET scan, positron emitters with short half-lives are combined with body substances, such as glucose. Positrons are used to study brain function, metabolism, and blood flow. So here we have two brains. It says these PET scans show a normal brain on the left and a brain affected by Alzheimer's disease on the right. See if you can kind of check out some different differences here. Okay, now in positron emission tomography, PET scan, positrons are emitted from positron emitters such as carbon-11, oxygen-15, nitrogen-13, and fluorine-18. So let's look at fluorine-18, for example. So our fluorine-18, when this radioactive isotope decays and it emits a positron, notice the other item that is going to be emitted then is our oxygen-18. Positrons combine with electrons to produce gamma rays. They are detected by computerized equipment to create a three-dimensional image of the organ. So a CT scan, which I'm sure you've heard of, a CT scan, in computed tomography, a computer monitors the absorption of 30,000 X-ray beams directed at successive layers of the target organ. And it's based on the densities of tissues and fluids in the organs. The differences in absorption of the X-rays provide a series of images of the organ. So in this CT scan here, So we have the brain, and then, so here's our skull, but the inside brain, notice this, really this abnormality here. So that a CT scan shows a tumor, that's yellow, in the brain. Now MRI, magnetic resonance imaging, is an imaging technique that does not involve X-ray radiation. It is the least invasive imaging method available, and it is based on the absorption of energy when protons in hydrogen atoms are excited by a strong magnetic field. Now, if you've ever had an MRI, and before you go into that MRI tube, they make sure you take off everything metal. Well, the reason is because it works by this very strong magnetic field, and if you have anything metal on you or metal in you, that's not good for the situation. It's going to be attracted to the really strong magnet. Now, it works because the energy absorbed is converted to color images of the body. So here we have an MRI scan that provides images of our heart and lungs.